In this segment, we're going to focus on the pre-CT general considerations, indications, and limitations for the abdomen. So as we begin each of these segments, we have to consider the overall advantages and disadvantages of choosing CT in general, which we've discussed in other segments. And it may be that you have to ask yourself a few questions prior to making that decision. Is CT appropriate for the anatomy I want to image? Will it hopefully answer the clinical question that I have in mind? Is it cost effective? Are there any contraindications that I should consider? And it may be that there are more appropriate imaging modalities to be considered first, or maybe more cost-effective imaging modalities. Which body area anatomic region should I scan with CT? In this case, it's the abdomen, but are there going to be any other body areas that I need to consider alongside the abdomen? And ultimately then, which type of acquisition do I need to perform? And this may be particularly pertinent for the abdomen. So when do we choose the CT for the abdomen? Well, it's often indicated, but ultrasound is often considered before abdominal CT, quite rightly, but it is operator dependent. So you need to have someone available or yourself be able to do a good abdominal ultrasound. And in some cases, it may be limited by the patient's size, their shape or body condition, and you may only realize this once you've got to the patient. But CT of the abdomen should provide a detailed tomographic anatomical assessment of the abdominal organs. It still has some limitations. What are our indications? Well, if you have pathology that's not fully characterized on radiographs or ultrasound, or your findings from those modalities are equivocal or non-specific, you might choose to take that step further to use CT. It's very good for assessing gross structural abdominal disease or characterizing abdominal masses, and these may have been found from previous imaging or may be palpable. If you've already identified neoplasia in a location, then it may be good for staging that neoplasia, looking at the liver and spleen for any secondaries, or looking for any lymphadenopathy that might accompany that neoplasia. It may be that you're investigating abdominal pain or abdominal distension. Maybe there's been trauma. Or maybe you already have some indication from your physical exam and biochemistry that there could be a vascular anomaly at play, such as a portosystemic shunt. You may be investigating disseminated multifocal or systemic disease, or you already have a lesion that has pre-existing or pre-identified that you need to do surgical planning for. For example, if there's an adrenal mass identified in ultrasound, then CT would be appropriate for surgical planning for an adrenalectomy. What information do we need and what options do we have prior to choosing CT? Well, like with all the body areas, a thorough physical examination is essential. And it may be that you already have identified any masses or swelling that might need sampling, and you can do that before the CT if it's safe to do so. Hematology and biochemistry will be essential in this case, and the biochemistry might help you to identify which abdominal organs you might be interested in examining. Or you may have already identified that there's peritoneal fluid or retroperitoneal fluid. So abdominocentesis with ultrasound guidance to help characterize that fluid is going to be of the utmost importance. Other first-line imaging you may have already considered. You may have already done an AFAST or point of care ultrasound, and this may be particularly important during the emergency situation. Otherwise, the combination of abdominal radiography and abdominal ultrasonography are often used first line to try and characterize abdominal disease. Remembering that a combination of serial abdominal radiography alongside ultrasonography is often sufficient and very useful in the first line for assessment of the gastrointestinal tract, particularly as it is a dynamic organ and is moving and trying to pass whatever material is within it over time. So let's have a look at the CT images here from a post-contrast soft tissue reconstruction of a canine abdomen. I'm going to run it through once just so that you can appreciate the contrast uptake in all the vessels and the parenchymal uptake of the liver and kidneys, and also the mucosal uptake of the gastrointestinal tract. In this case, this is a patient who's presented with clinical signs suspicious for a portosystemic shunt. And you can see the use of CT here by filling all of the vessels with contrast. We're able to follow them and follow their morphology in their 3D structure. In this case, an anomalous vessel has been identified extending from the splenic vein, coursing cranially as the left gastric vein, and then joining the phrenic vein and caudal vena cava at the level of the diaphragm just here, which is confirming and accurately characterizing the presence of a portosystemic shunt. In this case, it's an extrahepatic left gastrophrenic shunt. So CT in these cases is definitely the modality of choice for accurately diagnosing these sort of conditions. So what are the limitations of abdominal CT? Well, the contrast resolution of parenchymal organs with subtle lesions is limited. And it may be that ultrasound is more sensitive at detecting some subtle lesions in many situations, or there may be lesions seen on CT that may not be seen on ultrasound and vice versa. So you have to consider the limitations of CT in these situations. We still have to think about motion artifact. Although we're outside the thorax, respiratory motion can still affect the cranial abdomen. And so therefore induced apnea will be important. And this will be particularly pertinent if there's pathology related to the cranial abdomen, if you're investigating insulinoma, portosystemic shunts, or other hepatobiliary pathology, for example. And you may still need to sample the lesions with ultrasound guidance afterwards for a definitive cytological or histological diagnosis. The gastrointestinal tract has some limitations. You're going to get better conspicuity of the gastrointestinal tract wall layering on ultrasound. So you may need to do a subsequent limited GI ultrasound, particularly if you're investigating gastrointestinal tract disease, to assess the wall layering and thickness in better detail. What are the general acquisition considerations that you need to think about to make sure the CT is a success? Well, the patient needs to be in sternal recumbency and positioned symmetrically as with other studies. The hind limbs need to be extended caudally and positioned comfortably, and this is to remove the streaking artifact from the hind limbs over the abdominal organs. Particularly if you're investigating cranial abdominal pathology, again, achieving apnea to avoid respiratory motion artifact is paramount. So therefore, you may need to consider hyperventilation or chemical induction to get this, or you may have mechanical ventilation in-house. The planning of the contrast phases is particularly important with the abdomen, and you may be that multiple are needed, especially if you're trying to investigate a portosystemic shunt. So you need to carefully plan the timing of your contrast phases and to make sure that you can achieve arterial, portal, venous or parenchymal, and maybe urographic phases as well if you're investigating the urinary tract. If you want more information on this, then you can review VET.CT's protocols for abdominal CT acquisition, and there's more detailed advice in those resources. Finally, what are the common CT body areas that may arise? Again, similar to the thorax and abdomen go together in a lot of our medical investigations, and that's when we're looking for either disseminated multifocal systemic disease. Again, with staging of neoplasia, you may do the thorax and abdomen together, or you might have a disease process that is bicavitary or transcavitary in origin, and you want to assess it completely. So thank you very much again for listening to this segment. If you want any more information on abdominal CT, then please do not hesitate to get in contact with us. Thank you.